come, I must tell you that the first grant that HRDI got was a grant for $30,000. And I was working for an outfit at the time that could approve or not approve or recommend those grants. And we recommended that HRDI get this $30,000. The three founders of it was a guy named Sam Patch, who was one of Harold Washington's running buddies. And Harold wanted to appoint him alderman of the 3rd Ward, but we didn't do Sam. But his son did become the city treasurer of Chicago. And of course, the Ms. Lomax, yes, the woman, and of course the good doctor who's, yeah, Vince Bakeman, worked for Harold. He was a college professor at Kennedy King at the same time, and he started HRDI. So people used to do a lot of things all at the same time. Yeah. So right on for HRDI.
Absolutely. Thank you, Congressman Davis. Let's give a round of applause for Congressman Davis. And for all of our panel and members who are here today. I'm in awe, right, just to be in this room. And I thank you all who have stayed back. But I'm kind of like, you know, the NBA referee who can't really make the calls because I'm looking at all the stars as they play. This is kind of how this forum has been for me. I've enjoyed it, get a chance to listen to and interact and engage with the esteemed panel members here. But as Congressman Davis has stated, I stand on broad shoulders. I come to you as a representative and on the behalf of HRDI. I'm the executive director for HRDI. HRDI is Human Resources Development Institute, and it's an organization that has been embedded in the Chicago South and far South Side communities for nearly 50 years. Will actually be 50 years January 22nd, 2024. So we're going to have all the commercials coming out. We want you all to come and join us as we celebrate our 50th. But HRDI has been embedded in the South Side communities, as I stated, for a long time, providing comprehensive behavioral health services to the individuals who are, you know, experiencing serious mental health issues, folks who have, you know, serious substance use disorder conditions. And we provided the wraparound services for those. And I come to you on the shoulders of Dr. Bakeman and Ms. Lomax, who are the founders of HRDI. And they founded, you know, the organization due to a need and a cause that was right before their eyes. So they built from the ground up an organization that became a national organization and is now institute here in Chicago. And I'm just, you know, peacock proud and honeymoon happy to be able to continue on the path and the journey that they started. I was asked to come and talk to you all about certified community behavioral health services and designation. And I am honored to say that HRDI was recently awarded the designation as such. And so what is a certified community behavioral health center or clinic? It is exactly everything that the folks here have talked about today. It's the wraparound services, it's the collaboration, it's the integrated health model where you can go and get physical health and behavioral health all in the same setting, under the same roof, and then even outside of the four walls of the organization or the facility or the community-based operation that you go to receive those services. Illinois was fortunate enough to be able to have 17 organizations that receive such designations, and there are only 2 that are here in Chicago, right? That's a good thing for Illinois, right? Well, no, I don't think so. I think a better model is that if we imagine, right, if we imagine, you know, the 2,000 or so behavioral health organizations that are in Illinois, and all of them are certified community behavioral health centers. Just as it was stated right before me, wouldn't it be nice to have a location, a clinic, a place you can go get services, just like you can go get a cup of coffee from a Starbucks Absolutely. And so that's what a certified community behavioral health presents and gives us. It gives us the resources, the funding from the federal government to be able to provide those resources to any and everybody who needs them in a wrapped around, comprehensive, and complete manner. If you want to compare it, if you look at your federally qualified health clinic, a certified behavioral health center is the equivalent to that. The needs and the services that are provided is specific to the behavioral health population. Those folks who are in need of, again, services to support serious mental health conditions, services to support substance use disorder. So I close by saying Congressman Davis has done a remarkable job with passing legislation and making it known the importance of us having the resources available for us to have a model like the Certified Community Behavioral Health Clinic status in Illinois. And so we have to get behind his efforts and make sure that trickles down to the state and push our state legislators and our state agencies to move forward with becoming a designated state so that all of our behavioral health organizations, all of our community mental health clinics can become certified behavioral health clinics and receive the federal funding that's needed to accomplish what we all envision and imagine. And that's that wraparound service, that availability of services right outside of your front door, just like we can go get a cup of Starbucks coffee. So thank you. Thank you, Congressman.